Cullen and Gray Turner signs are suggestive of which condition? Options are A. Ectopic pregnancy, B. Appendicitis, C. Pancreatitis, D. Cholecystitis. The answer is C. Pancreatitis. Cullen sign, which is a periumbilical bruising, and Gray Turner sign, which is a flank bruising, suggestive of hemorrhagic pancreatitis. Public spots are a classical early sign of. Options are A. Chickenpox, B. Typhoid, C. Measles, D. Rubella. The answer is C. Measles. Koplik spots are tiny white lesions on the buccal mucosa, which is a pathognomonic for measles. Which signs are most indicative of a basilar skull fracture? Options are A. Bruising around the knees and elbows, B. Slurred speech and nystagmus, C. Periorbital ecchymosis and mastoid ecchymosis, D. Neck stiffness and photophobia. The answer is C. Periorbital ecchymosis and mastoid ecchymosis. Basilar skull fracture often presents with raccoon eyes, which is periorbital bruising, and battle sign, which is bruising behind the ears. Which neurological disorder is associated with pill rolling tremors? Options are A. Multiple sclerosis, B. Myasthenia gravis, C. Parkinson's disease, D. ALS. The answer is C. Parkinson's disease. Parkinson's disease often presents with a characteristic resting tremor, which is known as pill rolling. A patient presents with a moon face appearance and a buffalo hump. What is the most likely diagnosis? Options are A. Addison's disease, B. Cushing syndrome, C. Hypothyroidism, D. Acromegaly. The answer is B. Cushing syndrome. Cushing syndrome is characterized by excessive cortisol levels, leading to distinctive features like a moon face and a buffalo hump. Pseudomembrane formation in the throat is indicative of. Options are A. Kawasaki syndrome, B. Diphtheria, C. Pertussis, D. Scarlet fever. The answer is B. Diphtheria. Diphtheria causes a thick gray pseudomembrane over the tonsils and throat. A child presents with a sausage-shaped abdominal mass. What is the most likely diagnosis? Options are A. Pyloric stenosis, B. Intussusception, C. Appendicitis, D. Hernia. The answer is B. Intussusception. Intussusception involves telescoping of the intestines, often presenting with a sausage-shaped mass. Positive trousers and Chomsky sign are associated with which electrolyte imbalance? Options are A. Hyperkalemia, B. Hyponatremia, C. Hypocalcemia, D. Hypermagnesemia. The answer is C. Hypocalcemia. Both signs indicative of neuromuscular irritability due to low calcium level, characteristics of tetany. A patient reports sudden flashes of light followed by a shadow like a curtain falling across their vision. What is the likely diagnosis? Options are A. Glaucoma, B. Retinal detachment, C. Cataract, D. Macular degeneration. The answer is B. Retinal detachment. The retinal detachment is often preceded by flashes of light and a sensation of a curtain or a shadow over the visual field. Brudzinski and Kerning signs are used to assess which condition? Options are A. Meningitis, B. Multiple sclerosis, C. Guillain-Barré syndrome, D. Parkinson's disease. The answer is A. Meningitis. Both Brudzinski's and Kerning signs are indicators of meningeal irritation commonly seen in meningitis. Chipmunk facies is most commonly seen in which eating disorder? Options are A. Anorexia nervosa, B. Bulimia nervosa, C. Binge eating disorder, D. Pica. The answer is B. Bulimia. Bulimia can cause parotid gland enlargement, resulting in a chipmunk appearance due to chronic vomiting. A strawberry tongue is typically found in options are A. Kawasaki syndrome, B. Diphtheria, C. Typhoid, D. Measles. The answer is A. Kawasaki syndrome. Kawasaki disease presents with a bright red, that is strawberry tongue, among other symptoms. A red beefy tongue is indicative of options are A. Iron deficiency anemia, B. Kawasaki syndrome, C. Pernicious anemia, D. pellagra. The answer is C. Pernicious anemia. Pernicious anemia causes glossitis, which presents as red, swollen, beefy tongue due to vitamin B12 deficiency. A child with a protruding tongue and intellectual disability is most likely to have options are A. Kawasaki disease, B. Down syndrome, C. Cerebral palsy, D. Fragile X syndrome. The answer is B. Down syndrome. Down syndrome often presents with a protruding tongue and intellectual disability. A patient presents with a characteristic butterfly rash across the cheeks and nose. Which condition is most likely? Options are A. Rosacea, B. Psoriasis, C. Systemic lupus erythematosus, D. Dermatitis. The answer is C. Systemic lupus erythematosus. The butterfly or molar rash is a hallmark of systemic lupus erythematosus, often triggered or worsened by sunlight exposure. Hi nurses. If you find the video useful, please like, share the video with your nursing friends, and don't forget to subscribe my channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.